Now, tomorrow night on ABC's Four Corners, it brings you a powerful story of one of the ABC's own reporters, veteran Liz Jackson, who comes to terms with her battle with Parkinson's disease. She is one of around 70,000 Australians living with the progressive neurological condition.
Well, there's no known cause for the illness, which affects the ability to control movement. Gary Latham was diagnosed with Parkinson's disease 4 years ago. He joins us now, along with Steve Sant from Parkinsons Australia. Good morning to you both. Thank you for taking the time to come in and speak to us.
No problem.
As we mentioned, a little bit of a spotlight being thrown on the condition, Parkinson's disease, with the report we're expecting tomorrow night, featuring Liz Jackson and, you know, her struggle, I suppose, in some respects, with coming to terms with the illness, the diagnosis, and the impact it's had on her life. So a chance for us to catch up with you, Gary. It's been 4 years since your diagnosis, hasn't it?
Yep, 4.5 years, so I'm actually quite good at it now.
Just tell us then your story about when you were diagnosed, the symptoms that you had and how it ended up being diagnosed as such.
First thing I thought I'd done my arm from walking the dog. And then I thought I did a rotator cuff on my shoulder. And then I had like my left hand was swollen up. And it was like I had a fat person's hand. And I went to see a masseuse when I was on holidays in Byron Bay. She referred me on to because I thought I had a trapped nerve. She referred me on to a osteopath. Ended up seeing an osteopath in Sydney. And he said, look, before I do anything else, I think you should go and see a neurologist. And he was right. So when it all got done, I took a bottle of wine back to him and said thank you very much because it could always drift on for ages before you know what's going on.
So that's one of the aspects of the illness, is that it can be difficult to diagnose in the first instance.
Very difficult. Many Parkinson's patients say it takes years to get diagnosed. And the symptoms can be like Gary. They could be a shoulder, they could be losing your sense of smell, it could be constipation, it could be a whole variety of things. So it's not just the shakes. In fact, you know, about 30% of people who get Parkinson's don't get the shakes.
So Gary, what's the expectation for you? So you obviously sat down with a doctor and says, right, this is Parkinson's disease. Did you know much about it before that?
Not really. So, you know, Muhammad Ali, Michael J. Fox, Adolf Hitler had it.
Oh,
yeah.
There you go.
But that's sort of how much you know. But no, I didn't know that much about it. The main things are stiffness, slowness and tremor. Mine's more tremor dominant. If I wasn't on medication, my left side would be pretty much not moving at all. But it's something that's it's there and you just deal with it.
And of course, it's also quite difficult to determine what's causing the illness, because in the case of Muhammad Ali, some suspect that it may have been his career as a fighter, may have contributed, but it may not necessarily be a genetic factor as well.
There's a small genetic factor. Some people who have a particular mutation are more prone to it, but that doesn't mean they'll get it. We don't know what causes it. That's part of the problem. It's very hard to find a cure when you don't know what causes the problem. So there's lots of theories around, like environmental factors, prions like in the mad cow disease, genetics, iron overload disorder, you name it. They're working on it. We're getting close, but we're not quite there yet.
But am I right in saying that in the brain it comes down to a lack of dopamine?
Yeah.
So those neurons are not firing properly, essentially.
Yeah. So dopamine's produced by some cells in the brain which are depleted in Parkinson's, and dopamine's the thing. It's a messenger, so it sends messages between cells. So when you want to raise your arm, that messenger says raise your arm. And that's the problem, is you haven't got that messenger, then you're not doing anything, or you have abnormal movements. And it also affects all the other parts of your body. So like Liz, she's had anxiety and depression. Depression is very common in Parkinson's because dopamine is a feel-good neurotransmitter.
And in your case, of course, there's a treatment that you're undertaking.
Yeah, I'm on Cifrol and Cinnamate, but there's side effects of those things. My wife was told to watch out for obsessions like porn and gambling, so pass out as far as I was concerned.
Yeah.
And you obviously use humour as a way of taking the edge off.
Yeah, from the start, because my wife had had MS for 15 years before I got diagnosed, so acceptance came really easy. It was like we had one flat tyre and then we had two. So I moved through those 5 stages of grief, as they say, pretty quickly, onto the Australian 6th stage, which I call taking the piss.
Which you obviously did very well.
Yeah.
When you look at treatment, I mean, you say you're on certain medication. What treatment is available?
Okay, so what they try and do is replace that dopamine, but it's like hitting a nail with a sledgehammer. You just flood the body with this neurotransmitter, and it affects everything. So you can have, as Gary said, you can have side effects like compulsive gambling. You can have abnormal movements, and over a period of time, and it varies from person to person, it becomes much less effective. So the first few years is great. People can have Parkinson's for 30 or 40 years, and that first period is often quite good. They come back to fairly normal movements. They can do everything they wanted to do, but over time it slowly degenerates as those cells in the brain we lose them essentially.
That's an interesting point, because we look at those people famously who have Parkinson's, such as Michael J. Fox, who he was diagnosed years ago.
Yeah, 25 years ago.
But he's obviously managing the disease successfully.
Yeah, he just had he was just on stage playing guitar with Dave Matthews Band.
Yeah.
Yeah, so you can, a lot of it I find is about how you feel about yourself and how other people view you, and that's why it's good to have shows like Tomorrow Night, because it's a very social thing. If my tremor's fairly obvious, and you get a masked face and stuff like that, so people don't always view you socially as what you once do. And I know a lot of people with Parkinson's. Some people, your voice gets smaller, so they have trouble talking. Like there's a guy Bernie I know, and he has to wind up his voice to talk and wind back down again. And so a lot of the times you either don't tell people or you fall out of that social group. Whereas I just like people to take, if they know people with Parkinson's, to take the time to listen to what they've got to say, because it's still going on in here and it's still going on in here, but it's just a little bit harder to have conversations.
And it's important, everybody's different in Parkinson's. If both Gary and I both had Parkinson's, you guarantee our journeys would be totally different. And that's quite different to most chronic diseases. You can say, okay, well, you've had this chronic disease for 5 years, these are the sort of symptoms you're going to have, here's where you're going to be. Parkinson's can last 3 or 5 years, or it can last 30 years or more. So it's just different, and that's one of the issues we face with caring for people with Parkinson's.
Well, Gary Latham and Steve Sant, thank you both very much for talking us through what the condition is and the positive messages that you've got for people out there as well. Thank you very much for your time.
Thank you.
Thanks.
Thank
Cheers.
you.